Hello everyone, welcome to the channel Obstressed. This is the place where we will discuss about the obstetrics and gynecology and the stress it is causing in all of the people. And such an important but stressful topic is Gestosis Score. Gestosis score is a score which is given by FIGO, and this deals with the preeclampsia in women. So it is basically a risk calculation score where we are calculating the risk of preeclampsia in a pregnant patient. And in this, we have multiple pointers to remember, and these are a huge number of pointers. So that is why it is very difficult to remember this score, but it is really important. Why? Because we can calculate the risk and we can predict preeclampsia after calculating the risk from this score, and we can also start aspirin on its basis so as to prevent the patient from developing a very life-threatening condition like preeclampsia. So today I'm trying to tell you the pointers how you can remember the Gestosis score. So let's start. First, let us highlight this name, which is Gestosis score. Now, there are three categories in this Gestosis score where we have divided the risk factors into three groups. So the score deals with the 3 points: 1 point, 2 point, and 3 point. 14 variables are given 1 point, 6 variables are given 2 point, and 7 variables are given 3 point. So as to ease the process of remembering this score, I have divided these into 3 point wise tables: 14 variables which have 1 point, 6 variables which have 2 point, and 7 variables which have 3 point. So this makes the maximum score 47. Now we will discuss about the 1 point variables and how we can remember these. So you have to remember it like the 1 point variables are age more than 35 years, age less than 19 years. That means both of the extremities have age, as both the extremities of age are a risk factor. Obesity, in which BMI more than 30 is given point number 1, whereas if there is BMI more than 35, then that is a more high risk situation, so it is given a point number 2. Excessive weight gain in the pregnant patient. Excessive weight gain is calculated as, or it is considered as excessive weight gain in pregnancy if the weight gain is more than half kg in a week or more than 2 kg in a month. Then it is considered as excessive weight gain. Next pointer is primigravida. Primigravida is given a point number 1 because nulliparous and primi patients are more at the risk of developing preeclampsia as compared to multigravida. Next is previous pregnancy more than 7 years back, that is long birth interval, short duration of sperm contact, and conception by IVF or ICSI. Next pointers are related to the history, like family history of cardiovascular disease, history of PCOS in the patient, history of chronic vascular disease or dyslipidemia in the patient, history of SGA in the mother. That means the female who is right now pregnant was an SGA baby on her own. Next pointer is mean arterial pressure of more than 85, and next point is maternal anemia. So these all make up 14 points. 2 points are given to 6 variables, and these are obesity, in which BMI is more than 35, previous pregnancy history of hypertension. That means in previous pregnancy patient has history of hypertension, family history of preeclampsia, GDM, that means gestational diabetes mellitus, hypothyroidism of pregnancy, and twin gestation. These all are given 2 points. Now 7 variables are given 3 points, and these variables are if the conception is by ovum donor or by surrogacy, if the patient has chronic hypertension, pregestational diabetes, and conditions like autoimmune diseases, especially SLE, thrombophilias, hereditary or acquired, chronic kidney disease, and mental disease. These points are given, these 7 variables are given 3 points. Now, how do we remember it? Because as you all can see that it is a very complex score. So the way to remember this score is like we will start by remembering the 1 point table. Like 2 pointers we have to remember for age, more than 35 and less than 19. Then we have to remember 2 pointers for weight, obesity, BMI more than 30, and getting obese in this pregnancy. That means excessive weight gain. And when we are remembering obesity, BMI more than 30, at the same time, we can remember that if the BMI is more than 35, then we will give 2 points. So one variable of 2 point table is also done. Next is previous pregnancy, more than 7 years back, and priming. These are the special points regarding this pregnancy, like priming gravida. Then we will ask about the previous pregnancy history, if it is 7 years back or not. Then we will ask about this pregnancy, that short duration of sperm contact, and how has she conceived, which is also an important history in history taking, the conception history, if it is by IVF or ICSI. So we can remember 1 point of the 3 point table, that if the conception is by ovum donor or surrogacy, then it is the 3 point variable. So 1 pointer is also done there. And with the previous pregnancy, we can remember one more point in table of point 2, that is previous pregnancy has history of hypertension. Next, we have 4 history points. First is family history of CVD. Next is history of PCOS in patient, history of chronic vascular disease in patient, and history of SGA in the patient at birth. Similarly, we have 1 point in a 2 point table of history, which is family history of preeclampsia. Now we can remember separately. Like in the 1 point table, there are 2 points only left. One is mean arterial pressure and other one is maternal anemia. Now, as we have done one disease in the 1 point table, so that one disease which have to be done in the 1 point table should be the disease which is so common in India. That is why we are giving it less point. We can remember it like that. Okay, so maternal anemia is given 1 point, but at the same time we have also have to consider the other diseases which are common in the pregnancy, which are GDM and hypothyroidism. So we will put them in the table number 2. So we are done with table number 1. We are done with the table number 2, 5 points. But last point is the twin gestation. So we can remember it as it is. Now in the table number 3, we have learned conception by the ovum donor or surrogacy. We can remember, like in the point number 2 table, we had GDM and hypothyroidism. Okay, so in table number 3 we will have the chronic diseases. So table number 3, or the table which contains the 3 point variables, these are basically chronic diseases like chronic hypertension, pre-gestational diabetes, and these four, if you are having any problem, then I also have a mnemonic for these, and the mnemonic for these is ABCD. A for autoimmune disease, B for blood disorder, that is thrombophilia, C for CKD, and D for the market disorder, that is mental disorders. So by this we have learned all the variables. Now, how do we calculate the risk? So it is the total, if we calculate all the points, then maximum score possible is 47, and it is stated that if the risk factors total score is more than or equals to 3, then the patient has risk of preeclampsia, and then you have to start aspirin to the patient in the dose 75 to 150 milligram per day daily till the term gestation, that is 36 weeks, or we have to stop the aspirin 2 days before normal vaginal delivery or cesarean delivery. I hope this Gestosis Score learning helped you in learning this complex score. If you want to see more videos like this, then please like the video and subscribe to the channel. I'm really very thankful that you came to my page and watched this video. I hope it was helpful for you. Thank you. Have a nice day.